Bismillahirrahmanirrahim. Welcome to Special Education with Hamid Naqvi. MCQs for mental retardation के सिलसिले का ये तीसरा हिस्सा पेश खिदमत है। तो आइए बिला तमहीद शुरू करते हैं। Question number 1. Which of the following is a form of a child abuse that is known to cause intellectual disabilities? Shaken baby syndrome, abused child syndrome, battered baby syndrome, or damaged infant syndrome? Correct answer is shaken baby syndrome. Next question. The quality of life of people with intellectual disabilities can be improved significantly with the help of basic training procedures that will equip them with a range of skills depending on their level of disability. The application of learning theory to training, and these are as is also known as applied cognitive approaches, applied treatment analysis, cognitive behavioral therapy, and applied behavior analysis. Correct answer is applied behavior analysis. Next question. Inappropriate, life-threatening, or challenging behaviors may be inadvertently maintained by reinforcement from others in the environment. Which of the following is a process that can be carried out in order to help identify the factors maintaining the behavior? Functional analysis, statistical analysis, behavior analysis, or procedural analysis? Correct answer is functional analysis. Next question. Many individuals with intellectual disabilities are conscientious and valued workers employed in which of the normal work environment? Individuals with more specific needs may need to pursue employment within sheltered accommodation, special workshops, sheltered workshops, or special accommodation. Correct answer is sheltered workshops. Next question. Disorders which are characterized by serious abnormalities in the developmental process fall under the heading of pervasive developmental disorders and are usually associated with impairment in several areas of development. From early infancy, some children will exhibit a spectrum of developmental impairments and delays that include which of the following? Social and emotional disturbances, intellectual disabilities, language and communication deficits, or all of the above? Correct answer is all of the above. Next question. Early manifestation of symptoms such as severe impairment in social interaction and in communication can be diagnosed as which of the following? Infantile autism, infantile amnesia, cerebral palsy, or Rett's syndrome? Correct answer is infantile autism. Next question. In autistic spectrum disorder, when as individual exhibit immediate imitation of words or sound they have just heard, this is known as acoustic disorder, phonological inhibition, echolalia, grapheme dysfunction. Correct answer is echolalia. Next question. When an individual with multiple cognitive disabilities has extraordinary proficiency in one isolated skill, this is known as Rain-Man syndrome, Asperger's ability, intellectual isolation, or savant syndrome. Correct answer is savant syndrome. Next question, Ji. The AAMR classification scheme for mental retardation is based on levels of sport. Limited level of sports include an intensity of sport characterized by consistency over time, sport on an as needed basis, sports characterized by their constancy, high intensity and provided across environments, or sports characterized by regular involvement. Correct answer is an intensity of sport characterized by consistency over time. A structured environment where a person receives training and works with other workers with disabilities on job is an example of a supervised job with a job coach, on the job training, a sheltered workshop, or a high school vocational educational program for students with special needs. Correct answer is a sheltered workshop. Next question is, according to the text, individuals should be cautious about placing too much faith in a single score from an IQ test. There are several reasons for caution, which include all of the following, except IQ tests are not the absolute determinant when it comes to assessing a person's ability to function in society. Idea regulation requires the use of multiple assessment instruments, and individual scores can change from one testing to another. The younger the child, the less reliable and valid the IQ test. Correct answer is idea regulations require the use of multiple assessment instruments. Next, G. Butler et al. 2001 recommended an instructional sequence that could be implemented with students with mental retardation. This sequence includes all of the following steps except step-by-step strategy instruction provided to the whole class using direct instruction, one-time math trial to promote fluency, small group work that includes work at the concrete, representational and obstacle levels, one-on-one tutoring using a problem-solving strategy. Correct answer is one-on-one tutoring using a problem-solving strategy. Next question is, educational programming for students with more severe mental retardation often includes the following features except systematic instruction, adaptive physical education, functional behavior assessment, and positive behavioral support, or instruction in real life setting with real materials. Correct answer is adaptive physical education. Next question is, of children with disabilities, approximately what percentage are considered mentally retarded? 6.5%, 9.2%, 18.3%, or 23.1%? Correct answer is 9.2%. A student with epilepsy will most likely display which of the following behaviors? Staring and or convulsions, complaining of nasal congestion and ear aches, difficulty learning to spell, shaking and unclear speech. Answer: starting and or convulsions. Sorry, staring and or convulsions. Next, a student whose speech is hoarse, harsh, or too loud has which of the following disorders? Voice disorder, language disorder, fluency disorder, or articulation disorder? Correct answer is voice disorder. Sidra has difficulty working independently. When asked to sit in her seat for long periods of time, she frequently gets up to sharpen her pencil, look out the window, or flip through books on the bookshelf. She does not poorly or repetitive tasks. She does poorly on repetitive tasks such as math drills, and she rarely completes her homework. Sidra most likely has which of the following condition? Mental retardation, attention deficit hyperactivity disorder, Down syndrome, or dyslexia? Answer is attention deficit hyperactivity disorder. Next question is: an enrichment program is a standard option for teaching which of the following groups of children? Children with attention deficit hyperactivity disorder, children with autism, children who are gifted, children who are mentally retarded. Correct answer is children who are gifted. Next question. A dash involves a limitation on person's functioning that restricts the individual abilities, whereas A dash is a condition imposed on a person who has a disability. Number one, disability handicap. Number two, epilepsy dyslexia. Number three, gifted mental retarded, or language disorder, voice disorder. Correct answer is disability handicap. Next question is: Uzma keeps rubbing her eyes during the teacher's lesson, which takes place through the use of an overhead. She also holds books close to her face when she reads, and she has even complained to her parents that sometimes things on a page appear to be moving around. Uzma has a receptive disorder, or expressive disorder, or visual impairment, or attention deficit hyperactivity disorder. Correct answer is receptive disorder. Ali is once again not following direction. The teacher notices that Ali usually has no problems following direction if he turns one ear toward her or if he asks several questions to have the direction repeated. Ali most likely has which of these conditions? Visual impairment, hearing impairment, articulation problem, or mental retardation? Answer is hearing impairment. Mr. Hamid have a new student named Ali. His class starting next week. The principal has informed Mr. Hamid that Ali has a disorder that causes unclear speech, a lack of muscular coordination, and shaking. Ali will be using a keyboard to do his written work, and his speech and voice synthesizer will improve her communication. Which disorder is Mr. Hamid's new student Ali likely to have? Autism, visual impairment, hearing impairment, or cerebral palsy? The correct answer is cerebral palsy. Next question is: a child in your class is identified as being mentally retarded. In addition to having low intelligence, the child will also likely exhibit deficit in adapting to everyday life, deficit with regard to social responsibility, deficits in skills such as toileting, feeding, and self control, deficit with regards to peer interaction. Answer is all of the above are correct. Uh, uh, Answer is all of the above are correct. Next question. Sidra has problems pronouncing sounds correctly, and as a result, she avoids communicating her peers and is often embarrassed by having to discuss anything with the teacher. Sidra's parents have begun to take her to a speech therapist, and Sidra's speech is slowly improving. Sidra is almost likely to have autism, visual impairment, articulation disorder, voice disorder, or fluency disorder. Correct answer is articulation disorder. Uzma finds it difficult to communicate with her peers and her teachers. She usually understands what they are saying to her, but when she tries to communicate her response and express her thought, she finds it very difficult. Uzma is most likely to have expressive language disorder, articulation disorder, receptive language disorder, or voice disorder, or fluency disorder. Correct answer is expressive language disorder. Next question is Mrs. Fatma has just been informed that she will have several students in her class next 2 years with learning disabilities. Mrs. Fatma can expect these students to all have normal intelligence or above, have difficulty in at least one academic area or usually several, have no other diagnostic problem or disorder that can be attributing as a cause of the disability. All of the above are correct. Answer is all of the above are correct. Next question is Ali has trouble paying attention to the teacher's instructions and command. He often seems distracted and he has trouble staying in his seat. He often wanders around in the classroom. He fidgets when he is in the seat, and his handwriting is often messy and hard to understand. Ali most likely has which of the following: expressive language disorder, attention deficit hyperactive disorder, receptive language disorder, voice disorder. Answer is attention deficit hyperactivity disorder. Next question is Mrs. Fatma is concerned about one of his students. The student Ali has serious and persistent problems concerning his relationship with other students. He displays aggression and is often out of control. Ali displays signs of depression that can last up to several weeks, and he experiences fears that are often school related and interfere with learning. Ali is most likely to suffering from mental retardation, attention deficit and hyperactivity disorder, emotional and behavioral disorder, sensory disorders. Answer is emotional and behavior disorders. Next question is Ali has been identified as being gifted. Which of the following is most likely to be false with regard to Ali? He has an above average intelligence, usually 130 and higher. He is likely to be precocious. He will need a large amount of support and scaffolding. Scaffolding. He is likely to have a passion to master. Answer is he will need a large amount of support and scaffolding. Mr. Hamid is using technology in our classroom to help children with disabilities function in the classroom environment. The technology she is using consists of various services and devices that include communication aids, alternative computer keyboards, and adaptive services. What type of technology is Mr. Hamid using? Assistive technology, instructional technology, regular education technology, or receptive technology? Answer is assistive technology. Next question is, in the above scenario, Ali has been identified as being gifted. What are the programs, options available for educating children who are gifted? Special classes, acceleration and enrichment program in the regular classroom setting, enrichment programs in the regular classroom setting, mentor and apprenticeship program are in or out of the regular classroom setting, or work study programs in the community, or all of the above are correct. Answer, all of the above are correct. Ali is on anticonvulsant medication. However, he still has episodes in which he loses consciousness, becomes rigid, shakes, and moves jerkily. This episode can last a few minutes. Ali most likely has mental retardation, autism, attention deficit, hyperactivity disorder, or epilepsy. Correct answer is epilepsy. Most of the students who have been diagnosed with learning disabilities have which of the type of disability? Emotional disturbances, autism, hearing impairment, speech and language impairment. Answer is speech and language impairment. To control their behavior, 85% to 90% of the children with ADHD are placed in classes that emphasize rigorous physical activities, are placed in an environment with limited structures, are taking stimulation and medication such as Ritalin, are placed in special education classes. Answer is, are taking stimulation medication such as Ritalin. Next question is, which of the following statements is true about students with ADHD? Most physicians refuse to prescribe medication for children with milder form of ADHD. The number of children diagnosed and treated for ADHD has increased substantially, by some estimates doubling in 1990s. Girls are diagnosed with ADHD equally as often boys. Although signs of ADHD are often present in the preschool years, their classification does not take place until the middle school years. Correct answer is, the number of children diagnosed and treated for ADHD has increased substantially, by some estimates doubling in 1990s. An important goal of which program is to improve outcomes not only for gifted students but also for all students. School-wide education model, individualized education plan, pull-out enrichment class, inclusion. Answer is school-wide enrichment model. Next question is, researchers have found that individuals with worldwide class status in a particular field such as music or sport not only have innate talent but also are born in a family with high social economic status, have a lot of luck, spend years on their training and deliberate practice, have higher than average intelligence. Answer is, spend years on training and deliberate practice. Next question is, students with repetitive, obsessive behavior, verbal or non-verbal communication problems, and school difficulties most likely has which of the following? Mental retardation, autism spectrum disorders, ADHD, serious emotional disturbance. Answer is autism spectrum disorder. Next question is, when teaching a child who is mentally retarded, a teacher should do which of the following? Repeat directions many times, provide abstract examples, set low expectation, give the instruction only once to improve the child's focus. Answer is repeat directions many times. Stay blessed, all of you, and best of luck in the examination.